I'm Dr. Becky Fitzgerald. I've got Emily here with us today, and she is here for her second treatment of Kybella. Can I turn you to the side a little bit? That we'll look at some of the pictures when she first started, but this was a little pooch, and it's much, much flatter, and now we just kind of want to polish it off. So I'm just feeling the bone. Okay, go like this. So you can really kind of feel the borders. And they were talking this weekend too about should you feather as you move out here. So we're just going to go kind of in here, right? Okay, so now we're just putting our little markers so that we know exactly where we want to place the product to make it very even. Hold this under here. And we're just taking out the ones that are not in the area to be treated. Okay, I'm going to pinch it. I'm going to try and stay fairly superficial. How much does that burn?
Hardly at all. It's just
Really?
like a little sting.
Okay, I'm just going to try and move fairly fast. And you tell me if it starts to burn enough that you want me to stop and numb you off. Okay?
Exactly.
It does help having the little dots, and it helps having the color. So if you had to rate this pain, Emily, if like 1 was, I don't know, stubbing your toe and 10 was getting hit by a truck, where would you put this?
Maybe a 2, 1 or 2. And having had it with the numbing last time, I would say it's actually the injection of the product is about comparable to the injection of the Lido.
Of what?
Of the
Of the
numbing.
lidocaine? Yeah. Yeah, I would imagine that's true. So it would have to really burn and hurt after probably to make it worth doing the lidocaine.
It's minor pain, like a little sting at each injection. Ice helped, and then I think it is, if I touch it, I think it is already going a bit numb.
What I want to ask you is if you're glad that you did this the first time.
Yeah, definitely.
Yeah? Okay. Are you looking forward to seeing it shrink up a little bit more with the second one?
I definitely.
Okay.
I was happy with the results after the first treatment. I could definitely tell that there was a change and improvement.
Yeah.
But I think there was still even more room for improvement. So I'm hoping that this one takes care of the last little bit.
So since you've done it before, you sort of know what to expect. This is going to swell a little bit over the next couple of days. It's going to feel kind of warm. It's often that it feels pretty numb. After about maybe 3 weeks, it begins to feel kind of indurated, which means it feels hard. Sometimes almost like little buttons every place that we inject it. It'll feel a little bit funny. And then that starts to go away and you begin to see it kind of shrink back up. So I'd like to see you again in a month so that we can see what it did. But if you have any problems before then, certainly feel free to call.
All right, we'll do.